any technical problems. So if you could just let me know that you can see the screen well, it would be wonderful. Oh, perfect. Thank you very much. Brilliant. Thank you so much. Okay, so I think we're going to start. I'm recording the webinar, so if you're missing it, if you won't be able to wait till the end of the webinar, do not worry about it because it will all be recorded, so you will have access to it for some time after the webinar. So welcome to BiorepeelCl3 webinar today. Let me introduce you the founders and the wonderful people who invented this product. The first person who I would like to introduce, maybe you know him, it's Dr. Andrea Malvezzi. He has a degree in pharmaceutical science and technology in the Department of Pharmacy at the University of Pisa, and also master in marketing and management of the pharmaceutical industry. His specialization is quality management system for medical devices. He's the CEO, president, and the co-founder of Siemens Aesthetics. And other person is Carlo Michelini, and he has a degree in pharmaceutical chemistry and technologies at the Department of Pharmacy, University of Pisa as well, and production manager, R&D management and consultant, and specialty in formulation and synthesis experience in the field of medical devices and cosmetics. So those are the people responsible for the wonderful results which we can achieve using BiorepeelCl3 and the product. I'm going to start with contraindications. There's, as with every single procedures, you are going to have some contraindications, and not many in this case, but there's always pregnancy, always breastfeeding. If there was a cancer, we need to wait until 3 to 5 years with the permission from the doctor, 3 to 5 years from the moment of completion of all the procedures. Autoimmune disorders, and there's lots of questions about autoimmune disorders. So why is it contraindication to the procedure? If you would be doing peel on its own, without microneedling, without therapy, without combination with other methods, it wouldn't really be contraindicated. Well, the problem with autoimmune disorders is that there is a lot of inflammation going on around the body. And if we're inducing controlled inflammation on the skin, our brain doesn't know that we are inducing this inflammation. Yes? So there's inflammatory state in our skin, there's inflammation going somewhere else, and then there could be possibility of the cells not getting and repairing the skin because they're going to be looking for the sort of the larger inflammatory state. So the skin might not be healing well, which very often is the case with autoimmune disorders. Diabetes, for example, that's why you have lots of problems with healing in diabetes patients. So those are the main ones. There's lots of patients, lots of customers with Hashimoto, which is thyroid disorder. If it's controlled, if it's under the doctor's surveillance, you can proceed with the peel. I would still proceed with the peel for all the patients with autoimmune disorders who have it in sort of regulated. But I would be very, very careful, as I say one more time, to do any more aggressive procedures, to do any microneedling. If you would be doing it, you might decide at your own discretion to do it. Please always be very gentle because we might have prolonged inflammatory state, which is not good for our body, which is not good for our skin. If you have any questions, please write them down. And as I said, I'm going to try to see all the questions, to answer all the questions, sorry. See them first. Okay, so BiorepeelCl3 biphasic technology, 2 phases, 4 functional complexes, 9 different actions. My slides don't want to work very well. Perfect. So for me, the most important thing is the product. Our product is very effective. It's going to work on every skin type, on every skin condition, most of the skin conditions. I'm going to explain you, of course, later on why. what exact ingredients are responsible for which action. And I hope when you understand that, when you know about that, you will be able to choose the right procedure for your patients. It's very safe. It is a very safe procedure if the procedure is done correctly. Honestly, within a couple of years, I haven't seen much problems with it. The only problem which you might encounter is going to be when someone is using inappropriate products at home. You need to remember that this is a very safe product, but this is a medical device. This product works really deep inside the skin. And if you're using at home, if your customer or patient is using at home products which contain AHA, BHA acids, retinols, retinoids, all the derivatives from retinol, there could be a cross reaction because we have already active ingredients in the skin, and the skin is going to be overstimulated. And overstimulation, again, it's not going to be good for our skin. Then you might have some breakouts, then you might have some irritations, but it's not going to be the problem. It's the combination of the products. That's why also it's very, very important to use the products which we recommend because they've been checked. We know they're going to work. They're going to enhance all the effects of your procedure. 40-60%, of course, it's what we do in the salon, it's what we do in the clinic, but also remaining percentage, it's the care at home. So it's really, really important. I'm going to tell you about the ingredients later on as well. Biphasic technology, it's a patented technology. We have obtained the patent this year, which is very important for the brand. It's multi-action, multi-level technology. So I told you it works on many different levels of the skin. So it's not only superficial product, it works on stimulation of the fibroblasts for the collagen and elastin production. It's an immediate effect and it's a long-term effect. And there's a question always from the customers. I don't know if you have this question. So if I'm going to do the course of this product, is this? So is it going to last forever? Unfortunately, there's no such product which is going to stop us aging. That's not possible. But it is a long-term effect because we are stimulating the collagen elastin production. We stimulate the mineralization of the skin. So it is a long-lasting effect. Of course, we need to maintain it. If it comes to usability, which is very important, it's appropriate for all phototypes. For phototype 1 to 6, there's no contraindications regarding Fitzpatrick phototypes. And we can use it on the whole body, which is very important. You can use it on the eyelids if it comes to the FNC. You can use it for the intimate zone mineralization, and it could be used all season. Just going to check quickly the messages. If I can peeling with mesotherapy in one session, what's the preferable first meso and after peeling? I'm going to talk about it in a second. Of course, you can combine peel with mesotherapy. I don't like calling it peel. It is the product because it's more than a peel. But yes, you can combine it with mesotherapy in one session. If it comes to what should be first, I'm going to talk about the ingredients, and then it's going to be easier to understand in which order we should be doing it. But I will explain all the procedures later on. Okay, 2 phases, lipolytic phase and hydrophilic phase. Lipolytic phase is the phase of the top, darker phase. It is protective antioxidant action, it's moisturizing action, firming, and it's also carrier action. So what it means, it's going to help carry all the active ingredients deep inside the skin. And hydrophilic phase, that contains all the TCA, alpha, beta, polyhydroacids, amino acids, vitamins, and GABA. Why is it important, this biphasic technology? This phase, which you can see at the top, lipolytic phase, it's going to make the product stable. It's protecting it from darkening, especially TCA. You don't need to keep the product in the fridge. After you open the top of the vial, you can keep it up to a month. Between 5 and 25 degrees, it doesn't have to be kept in the fridge. And the hydrophilic phase contains all the active ingredients. So it's stable in the room temperature, as I said. There's no TCA oxidization. It's not darkening, and it's protecting lipolytic phase. So, 4 functional complexes, I told you: BiorepeelCl3, lipo, bioglycine, proline, hydroxyproline, and vitamin C. We've got GABA, we've got arginine. If it comes to pure action, we've got TCA, lactobionic, salicylic, tartaric, and citric acid, squalane, and isopropyl nitrate. If the temperature is higher than 25 degrees, the product might start darkening. I wouldn't keep it at temperature higher than 25 degrees. It might not be stable. I haven't tried to keep it in such high temperatures. I always make sure that it's in the right temperature. I don't think if it's 1 or 2 degrees more, it's going to go unstable immediately, but the recommended temperature is between 5 and 25 degrees for the product to be stable and to be guaranteed to be doing what it should be doing to last week. If it comes to amino acids, I don't know what products you're working with in your salons or for mesotherapy, for other procedures in your clinics, but I think I consider amino acids the most important for our skin. Not any other products, but amino acids. Why? Glycine is the most abundant amino acids in collagen, 35% of glycine in collagen. It has strong antioxidant, regenerative properties. Proline, hydroxyproline, again, widely present in collagen. It increases and supports ceramide synthesis, activating keratinocytes proliferation, fibroblast production, so very, very important. We produce only 10 amino acids. We need around 29 amino acids in our bodies. Vitamin C, of course, not an amino acid, but a vitamin, but it is an essential cofactor in collagen synthesis. That's why it's so important, the presence of vitamin C in this product. It's a very strong antioxidant molecule. It protects from reactive oxygen species. It's regenerating and a very strong antioxidant molecule, as I said before. But the combination is really important. There's a lot of products with vitamin C on the market. I'm going to be telling you about BioreHydra, BioreLift. What's very important, it's combined with glucose, which means it's stable form. So it's going to be able to penetrate deep inside the skin, where then it's going to be transformed into pure form of vitamin C. GABA, this is the factor, this is the compound in this product, which is going to give you this wow factor for the customers. So straight away after the procedure, it's going to relax all those little lines, all those little wrinkles, so very effective anti-wrinkle actions. Arginine, I think one of my most favorite. And arginine, you've got lots of use. Of course, you know, if it comes to medications, it's used in modulation and regulation of the blood flow processes. So that's the medicinal use. But for us, it's very important if it comes to different skin conditions. For example, rosacea. In rosacea, you've got lots of inflammation. You've got a lot of broken, very thin, inflamed capillaries. With rosacea, we always work on subsiding inflammation, on supporting angiogenesis. Angiogenesis is the creation of new capillaries, new blood vessels, on strengthening. And this is where arginine is going to really help us. The same if you've got treatment of the scars, of the stretch marks, if you've got treatment of really any different type of scarring, which could be acne scarring, it could be post-procedure scarring. When you look at the tissue, the scar tissue, it's going to be quite, you know, if you would look at the thermoactive camera, it's going to be blue or green. It's just because, sorry, I was just distracted because someone was trying to ask a question. I'll answer all the questions later. It's very important because we need to, that's why we're inducing a little bit of damage to the scar, and I'm saying a little bit of damage, because if it's a large scar and we damage too much, we can cause necrosis of the scar, not redermalization. So we induce damage to the scar, and then we apply BiorepeelCl, and TCA and arginine are really going to help with regeneration, with the angiogenesis process, with delivering oxygen to the tissue, so redermalization of the tissue. Just let me check the questions. When the doctor put peeling drops before the treatment, when we put drops under ice. Now you can safely use it under ice. You can safely use it on the eyelid. It's absolutely fine to use it this way. Okay, so we've got so far all those ingredients which are responsible for aging skins, which are responsible for promoting collagen restoration, which are responsible for angiogenesis. So already we have so many different skins which would be really appropriate for this treatment. Another one is going to be vitamin B2. Vitamin B2, it has very important role in activation of other vitamins. And for us, if we think about the skin, it's really great for those oily, greasy skins, as it's going to help us to control the sebum production. And the acids, I think TCA is my favorite one. I've been using TCA for many, many years now. First, of course, we've been using TCA in this original non-buffered form, and then the healing process, the regeneration, restoration of the skin process was taking at least a couple of days where you just couldn't leave the house, when it was really strong exfoliation. But exfoliation effect of the TCA peel is not the most important. The most important, it is important, but it's not the most important. The most important is its activation of the all growth factors. So it's activation of the pre-inflammatory response of chemical acid stress, and then it's activation of the skin stress response system, and the growth factor production in response to chemical stress. So for me, this is the most important action if it comes to regenerating the skin, if it comes to healing the skin, if it comes to the treatment of the scars, if it comes to the treatment of many different skin problems. So we've got vascular growth factor. Again, very important with those rosacea skins. Do not be scared to use BiorepeelCl on rosacea skins. Of course, we're going to use it in the lower concentration, 35% concentration. I wouldn't use body concentration on rosacea skin, but we've got really great effects. You've got also palate-derived growth factor, so stimulation of the fibroblast and enhance wound closure, but stimulating epithelialization. TGF-alpha and beta-1, so again, production of proliferation of the fibroblasts and keratinocytes. Let me check questions. There's some questions. Is there any frosting effect? Well, it depends on the skin. If the skin is dehydrated, you might have a bit of frosting. If the skin has been prepared well, and what I mean about preparation, you do not have to prepare the skin for this treatment. But the problem is that sometimes, again, patients or clients use at home different products which might make skin sensitive, very sensitized, not sensitive, very sensitized. Again, retinols, AHAs, BHAs, and if they're using it at home, they should stop at least a week before you start the procedure. And then you shouldn't have any frosting. If you have frosting, nothing is going to happen. There might be a little bit of frosting, there might be a little bit of peeling. In some cases, we do want frosting to occur, but it's not anything which would compromise the effect of the procedure, so it's absolutely fine. You're also going to have a bit of frosting on all those skins where you have active acne, when there is, of course, a little bit of, the skin is compromised. So the product might be filtrating the skin faster. You might have pinpoint frosting. You leave it, you don't remove it immediately, so don't panic. Just leave it for 3 to 5 minutes, and then you're going to remove it with water. We do not neutralize the product, we only remove it with water. Let me see there. For the post-operative scars, would you recommend BiorepeelCl3 normal or the body one? First of all, for the post-operative scars, we have to wait for at least 6 months to a year. The whole process of scar healing, post-operative scar healing, takes up to a year. If I was to start treating the scar, I would use the body peel if the scar is on the body, but I wouldn't use any micropuncture needling or microneedling on the scar which is not at least 6-8 months old. I wouldn't touch that scar. Some people are finding trouble logging in. Can you fix it? No, there's nothing I can do. The problem is not on our site. It's going to be recorded. There's also quite a lot of people, and we have only limited 100 people. That might be the problem. But the webinar is going to be recorded, so I will make it accessible to everyone. If I can recommend preparation with AHA before BiorepeelCl3 procedure, no, I don't. I don't recommend preparation. Contrarily, if someone is using AHAs or BHAs products, AHAs or BHAs acids, I would stop it at least for a week before I start the procedure. Okay, another product is lactobionic acid. Lactobionic is going to be very healing, it's going to be very moisturizing, hydrating for the skin. It also reduces melanoproteinase production, so it's going to be protecting the skin from the chrono and photoaging. Salicylic, so we've got another skin type, which I think I mentioned before. So all those oily, all those acne skins, So salicylic acid, it's a powerful keratolytic. So it's going to have 2 actions. First of all, it's going to work topically on the skin, where it's going to cleanse all the congestion in the skin. It's going to be very strong bacteriostatic. It's going to have very strong bacteriostatic action. It's going to cleanse the pores. It's going to regulate sebum production, but also it has another action. So it's going to be able to loosen the cement which is between keratinocytes to allow for the penetration of the active ingredients. You can use it for any acne. For adult acne, you can use it for teenage acne. So all the different types of acne is going to work really, really well. If you've got those cysts, like acne cysts, I'm not removing acne cysts. If it comes to physical removal, I'm not touching those cysts. I'm never using any microneedling with on acne skins, because it could lead to bacteria spread. I would use BiorepeelCl3 on its own without any other combination. You can then combine it with the blue light, which is also healing antibacterial, has bacteriostatic action, but I wouldn't use any other procedure. I'm just trying to think if I haven't missed anything, sorry. I'm just going to check questions. Frosting effect, how can I use it with microneedling? We're going to talk about it. Frosting is not indicated. How much time remaining on the skin? I will talk about it. How effective is that melasma and pigmentation? Very effective, but I will talk about it in a minute as well. So let me finish about the ingredients, and then I'm going to tell you all about the procedures. Apart from salicylic, we've got tartaric, we've got citric acid, also powerful antioxidants, exfoliating properties, keratolytic action. Citric acid also is a calcium chelator, which means it's binding calcium ions and creating, again, the pathway for the active ingredients to go deep inside the skin. So all those are, as you see, one concept, 2 phases, 4 functional complexes, and 9 different actions in the peel. So lipolytic phase and hydrophilic phase. What's very, very